Good afternoon, and thank you for joining us here today. As Minister of Justice and Public Safety, I believe it is crucial that people in our province have faith in the administration of justice. Ensuring the safety and well-being of inmates at any provincial facility, together with providing a safe and healthy living and work environment for staff, are top priorities of this department. Following the deaths of 4 inmates at the Newfoundland and Labrador Correctional Centre for Women and Her Majesty's Penitentiary between August 31st, 2017 and June 30th of 2018, the Department of Justice and Public Safety retained the services of retired Superintendent Marlene Gesso to conduct an independent investigation. Ms. Gesso reviewed the circumstances surrounding the deaths, including staff response and the appropriateness of related policies and procedures. As part of the investigation, she interviewed correction staff and the families affected and was given extra resources to assist and to ensure the timely completion of the report. Our department has met with the families of the 4 individuals involved in this review process, and we express our sincere condolences to those family and friends of the deceased. I hope this report and my resolve to do better will result in an improved correctional system. The report makes 17 recommendations to the provincial government to improve the delivery of services and practices within adult custody in our province. The Department of Justice and Public Safety has accepted in principle all of the recommendations, and work is ongoing to address the issues identified in this report. We acknowledge that there is much work to do, but we are committed to improving the correctional system in this province. Many of the recommendations identify the need for review and enhancement of policies, procedures, and programs to ensure best practices are being applied. Immediately following the deaths, and even before this review was commissioned, in collaboration with our correctional facilities, direction was given to implement change and determine next steps. Some of the challenges we face are even bigger than changing policies. There are well-known infrastructure issues that present a challenge to implementing some of the recommendations. We are continuing to consider options to replace H&P, and as I have said previously, it is my #1 infrastructure priority. I'd like to provide some examples of change that has been made or is in the process of being made at our correctional facilities. Much of this work has been ongoing for some time. A second addictions and mental health resource was added to Her Majesty's Penitentiary, which will cut down on the wait list for services. To accommodate staff, inmates will return to their cells between 12 and 2 p.m., and our department is currently working towards implementing a system where regular and random checks will occur during this time. We have hired someone with expertise and background in corrections to review practice, policy, and procedure within adult corrections to ensure they are consistent with best practices moving forward. Doorways, a single-session mental health and addiction service, is now offered at all correctional facilities. The same program has eliminated wait lists for mental health services on the Burin Peninsula. At the Newfoundland and Labrador Correctional Centre for Women, psychologist hours have been increased from 10 to 12 weekly. Aboriginal liaison group and individual services provided by the St. John's Native Friendship Centre for Indigenous Females have been increased from 20 to 30 hours per week. Service focus is on support, advocacy, release planning, cultural programming, including translation services. Stella Bury services have been increased from 11 to 15 hours weekly. Services include group programming such as addictions, trauma, as well as dialectical behavior therapy and other alternative-based therapies to female offenders with complex mental health needs. To assist with additional program services, space has been updated to provide privacy to offenders receiving individual counseling sessions, and we have an increase in the visual counts of inmates. One of the actions in Towards Recovery, the Mental Health and Addictions Action Plan for Newfoundland and Labrador, was that responsibility for the provision of health services in prisons and the associated funding be assigned to the Health and Community Services System. Our departments have been working closely regarding implementation, and I'm very pleased today to be joined by my colleague, the Honourable John Haggie, Minister of Health and Community Services. He and his department have been working diligently to ensure we have a smooth transition and that we're able to offer improved services to those in our correctional facilities. And I'd like to give Minister Haggie an opportunity to speak to that work.
Thank you very much, Minister Parsons. I'd just like to take the opportunity to express my own sincere condolences to the families and friends of the 4 individuals who died while in custody. By accepting all 17 recommendations, we're ensuring the safety and well-being of all inmates in all correctional settings. As Minister Parsons pointed out, we are committed to the transfer of responsibility for all health services in correctional settings to the healthcare system, as outlined in our Towards Recovery Action Plan. In fact, last June, I announced that we would expedite the transfer of responsibility for health services of inmates from our original timeline in that document of 2 to 4 years to doing it within a year. And today, I can report that we are on target to ensure the transfer of responsibility of health services occurs this year. That said, we recognise the need to proceed with enhanced services immediately. Since last June, as partly referenced by Minister Parsons, we've initiated walk-in clinics, known as doorways, to all correctional institutions throughout the province. This means that currently, within each correctional centre, a mental health counsellor provides sessions to inmates on a weekly basis for those who wish to avail of this service, and no appointment is required. We have introduced Therapy Assistance Online, or TAO, at Bishop Falls Correctional Centre. TAO is available outside to users of the MCP healthcare system, and it provides cognitive behavioural therapy online and with the assistance of a therapist. To our knowledge, we may be the first to offer this service in any correctional facility in Canada, and we will be exploring the possibility of expanding TAO to other correctional facilities. We have, as mentioned, recruited a second addictions counsellor at Her Majesty's Penitentiary. A reported 80% of inmates have substance use problems. For this reason, we're making access to addictions treatment a priority. We'll continue to explore more programs and supports at all our institutions, including rapid access to Suboxone. We've also partnered with Eastern Health and established a provincial steering committee to oversee the transfer of services to the healthcare system. As a result, we now have a dedicated group of senior officials from the healthcare system, from the justice system, and our community partners, all at the table planning the transition of services. This collaboration is paramount to improving access to healthcare services in corrections. The Provincial Steering Committee will ensure that all healthcare-related recommendations in this report are addressed in the transition plan for health in correctional settings. Part of this work includes reviewing the training needs of healthcare workers and correctional staff, space and program needs at our correctional facilities, and reviewing the services themselves to ensure they're equitable to those available in the community and that they meet current needs. As part of the planning process, we've reached out to our colleagues in Alberta and British Columbia, who've already transferred this responsibility to their healthcare systems. Our model, like theirs, will ensure that healthcare services for inmates are equitable to those we can all receive in the community. We've also reached out to Accreditations Canada. This is the same organisation that accredits our regional health authority facilities, to survey current health services in the correctional centres, and their findings will guide the transfer of the services to ensure they meet the best practices and national standards for healthcare in correctional settings. So in summary, we're going to continue to expand access to health programs and services in correctional settings while we actually finalise the transfer of responsibility. Once transferred, inmates will have equitable access to healthcare services compared to those in the community. More importantly, we will have a system in place that integrates the health needs of the person at all stages while in custody, from screening and assessment, treatment planning, and discharge planning, with a focus on continuity of care and transitioning back into community-based services. Thank you. Andrew?
Thank you, John. And I'd like to thank Minister Haggie and all the officials in his department who've been working with us. It's a significant task ahead of us, and I appreciate their cooperation and their diligence. When I first came on as Minister of this department, it was apparent that there were changes that needed to be made in adult corrections, and we have made those a priority. I have visited all of the correctional facilities in this province, and I've had the opportunity to speak to both inmates and staff in every one of them. We hear their concerns and their suggestions, and we take their input very seriously. Just this morning, I actually exchanged emails with a resident in one of our facilities in this province, so it's something that I handle personally in a lot of cases. I want to acknowledge and to thank our correctional staff for the work that they do in a very challenging and very tough environment. I appreciate their hard work. I appreciate their commitment as we work through these changes that need to happen. The issues addressed in this report are important, and we are committed to working with our partners within government and in the community to improve the system that exists. We have an opportunity now to bring in positive change, and that is what we are in the process of doing. We look forward to continuing the work that is being done and to addressing the recommendations in this report. And again, to conclude, I want to express my condolences to the families that have been impacted by these tragedies. What they're going through is unimaginable, and we're going to take steps to make sure that this does not happen to any other family again.